Good evening, everyone. My name is Kiana, and while I'm not in class with you all, I am still here to be a part of the class virtually to share my story of my nursing situation. My nursing situation is about caring between a nurse and an adult female patient facing challenges with inaccessible housing and poor care adherence. I named my Karen story A Way In, A Way Out. On a routine day as a medical case manager, I received a referral for a Miss Camilla, a 52-year-old African American woman diagnosed with end stage renal disease, on dialysis, poor functional status, and COPD requiring supplemental oxygen. Her history also included chronic non-adherence to treatment, a pattern often met with prejudice rather than understanding. Her clinical picture checked all the boxes for a referral to the complex case management program. She was inpatient at a hospital in West Baltimore, and before visiting her room, I stopped to speak with her nurse and the social worker to gather context around her repeated hospitalizations. The nurse starts off by telling me that Miss Camilla is in and out of the hospital, and every time she turns around, Miss Camilla is admitted. The social worker then adds, I know she has trouble getting out of her house, so I gave her a list of housing resources to call. She'll be back here in a week. I asked for a copy of the housing list and received report from these two seemingly cynical healthcare professionals. I then made my way down the hall to see Miss Camilla. I entered the room quietly, careful to not disturb her roommate, and approached her bedside. I introduced myself, explained the services offered by the program, and handed her a folder with a flyer, my business card, and a blank personal health record designed by Eric Coleman. I've been assigned to support you, I told her. You can call me directly on my cell, and I'll be checking in with you regularly. Then I asked, what goals do you have for your health? And she looked at me and said, I want to get better, but it's hard for me to get out of my house. I hear these people always talking about me like I'm lazy and don't care about myself. I nodded quietly, believing her. I can tell this has been a repeated frustration she had expressed to hospital staff. I informed Miss Camilla that after discharge, I would contact her to schedule a home visit. Once she was discharged, I followed through and arranged the visit. I drove to her apartment complex, ironically named something with gardens in the title, but there wasn't a flower or blade of grass in sight. I parked and made my way down a narrow, dimly lit stairway that led to her basement level unit. I knocked on the door, and she yelled out to let me know it was unlocked. I entered ready to go over her health conditions, medications, discharge instructions, and follow-up appointments. But when I reflected on the fact that she had to leave her door unlocked for me, I paused. In that moment, all the clinical checklists faded, and I refocused on the obvious. This was no longer just about medicine or instructions. It was about her living conditions, her daily obstacles, and the systemic gaps that are contributing to her debility. Ms. Camilla explained that she frequently missed her dialysis appointments because of unreliable MTA mobility transportation. Sometimes the van would take too long to arrive. Climbing the 10 stairs from her apartment to the sidewalk while hauling her oxygen tank took every ounce of energy she had. If she stood too long outside, she would retreat back indoors. Often the van arrived after she had already collapsed into bed, too exhausted to try again. It became a cycle. Missed dialysis led to fluid overload, causing symptoms that ultimately required hospitalization. I went to our leasing office to advocate for a transfer to a ground level unit. They had no available apartments or accessible accommodations to facilitate easier access in and out of her current apartment. In accordance with the guidelines from the Housing Authority of Baltimore City and the Americans with Disabilities Act, Ms. Camilla was within her rights to break her lease without penalty due to medical necessity. I had the required medical forms completed on her behalf and began searching urgently for ADA compliant subsidized housing. During that time, she was hospitalized again within 30 days. After a couple of weeks of phone calls, emails, paperwork, and dead ends, I found a quiet apartment community in the beautiful Mount Vernon neighborhood. The lobby had cushioned chairs, which provided a space where she could wait for transportation without strain. The halls were clean. The units featured open floor plans, a washer, a dryer, central air, and most importantly, a drive-in area for door-to-door service. I met with the leasing representative on Miss Camilla's behalf and inquired about a one-bedroom availability. The apartment was on the second floor and accessible by elevator. I excitedly contacted Miss Camilla about the apartment and drove to the hospital with the leasing application. She was approved for the apartment soon after, and she called me with her daughter on three-way, expressing her gratitude and a future invitation to visit her in her new home. Although her case with me was initially for 45 days, we were given an extension to assess ongoing care interventions with now that she was in accessible housing. I continued to monitor her progress over the following 3 months. Her overall hospitalizations over a 4-month period dropped by 50%, and her dialysis adherence reached 100%. Ms. Camilla was one of our greatest success stories, illustrating the direct correlation between social determinants of health and health outcomes. Thank you.